Well, this topic today is to look at research that's been done in reference to homeopathy and some of the considerations having to do with doing research in this field of medicine. There is actually quite a bit of research that's been done. Hundreds of articles have been published. But one of the common criticisms one will hear is that there hasn't been adequate research done. And we're going to try to address that, explain what the complexity is. And also, I have a few example research studies at the end here that we can go over. So let's look at the question, why to do research? And we know that if we want to present, in our purpose in doing research, medical research, is to develop evidence that will be accepted by other people. In other words, we want to demonstrate the method and the results that we get to other people and show with evidence that seems to them to be reasonable. The problem we run into with homeopathic work is that it really is a different paradigm. It's a different system of medicine in the sense of its underlying principles. And it doesn't look at the patient or the evaluation of the patient and how to treat the patient in the same way as does the dominant system of medicine today in our culture, which is the allopathic system. And so because the two systems differ from each other in how they understand the patient and how to treat them, you can see that trying to transpose between the two can result in some confusion. So let's look at this in a little more detail. The kind of research studies that we could consider as might be suitable evidence would be case reports, individual or a small number of case reports. Another category would be retrospective field studies, and that's done quite a bit in looking at long-term effects of treatment methods. We could do a comparison of treatment protocols. In other words, have two groups of patients, each treated by the different system, and compare the two. We could do in vitro experiments, or we could try to just look at one aspect, one principle of the system, and try to show some evidence that it works. For example, in homeopathy, if we can show that the homeopathic medicine has some kind of biological effect, even though in the study we're considering it's not necessarily a treatment study. So as far as case reports, we did present two brief ones in prior meetings. In regard to retrospective field studies, the last one that we did, we looked at some epidemic statistics. So that was more like retrospective, and you might say field studies in the sense that they were naturally occurring diseases that were treated, and then we looked at the historical data. And then as far as comparison of the treatment protocols, then as I said at the beginning, we have the difficulty of comparing the two systems. So I want to go into that with you first so you understand how it's different. And I'm going to show you the working of a homeopathic case. And once we see how that's done, and you begin to appreciate to some extent how the thinking is different and how the approach is different, then you can see why directly comparing the research isn't as easy as one would think. So we compare the two paradigms. The allopathic model, the one that we're familiar with, the one that you're learning in veterinary school, emphasizes doing a diagnosis, which means to group the patients under a disease label or a disease category. In other words, the emphasis is on the accuracy of recognizing and determining what disease is present. And once that's done, once the patient is properly diagnosed, then on the basis of the diagnosis, there is a treatment protocol that follows. So for the most part, then, all of the individuals that have that diagnosis will have the same treatment, same drugs, or the same surgical procedure. Now, I know that's simplifying it somewhat because there can be some slight differences in terms of what drugs to use or what surgical procedure, but you get the idea that the treatment is based on the classification of the patient under a disease category. In the homeopathic model, each patient is considered to be an individual case. There are no group treatment protocols. There is no acceptance of the idea of diagnosis as it is in the allopathic system, but rather each patient, even though terminology may be used, like you might say, oh, so somebody has the flu or a dog has parvovirus, we might use that language, but when we approach that individual patient, we don't have a standard treatment for that name or that label, but each one is treated individually based on the specific details of the symptoms that they present to us. So here's an example case. We have a cat, Moses. He's 5 years old, and he's become recently ill. And what he's showing as far as his illness is that he's very lethargic. He's completely lost his appetite. If the person tries to make him stand, he cries out from the discomfort of it. And he has not moved himself voluntarily for 24 hours, just sitting or lying in one spot. There is a fever, and when it's taken, it varies somewhat, but it ranges between 103.5 and 105. Blood analysis shows a normal white cell count, normal neutrophil count, but very low lymphocyte monocyte numbers, suggesting possibly there's a migration of cells to some extravascular site. We don't know really what happened here exactly to him. We don't know if there's some kind of infection or if there's a bite or something. That information isn't available to us. These laboratory values are also elevated. SGOT, the CPK is very high, elevated direct bilirubin, and elevated blood glucose. SGPT is normal, as are BU and creatinine. So it kind of looks like, though we can't define it in a very definite way, it looks like there is some kind of a generalized inflammatory state. So that's our case here. And if we're going to approach it homeopathically, we look up these symptoms. And I'm showing you a picture here. There are books that enable us to do this, to look up this information, but I'm showing you pictures from a computer program that we use for this purpose. And the computer program is this particular section of what we call a repertory, which is a listing of symptoms, has a section for fever or heat as it's called. And within that section, there are what are classified, that's in the reference text is called pathological types of fever. And you see the listings of the different categories here. So the first one says adynamic, and it gives you, in parentheses, it gives you some definition of what that word means. And some of the words are a little bit older because these reference texts go back quite a ways, back many decades, because homeopathy has been used for such a long time that the information is accumulated, and some of the words are like ascetic. We don't really probably use very much ourselves anymore. Another example would be catarrhal fever. We don't use that word very much either, but it was used some decades ago. It was used quite often. So these are the categories, for example, of the types of fever as it's broken down in the reference text for homeopathy. And the numbers that here are after each one are the number of homeopathic remedies that are within that grouping. I'm going to show you here a second page because I couldn't fit it all in one slide here, or one projection. So this one is a continuation of the prior projection. It's a continuation of that listing of the types of fever. So you can just get an idea of how many different ways in which it's broken down in the homeopathic reference text. The one we're going to use here, and in this window, this picture, what I've done is I've expanded it to show the homeopathic remedies that are listed under each symptom or each category of fever. So in these prior pictures here, like back here, you don't see those homeopathic remedies. It just shows you the number. But I've expanded it here so you can see not only the name of the type of fever, but the homeopathic remedies as they're listed for the treatment of that. So the one I'm going to use in this case, the one I did use, is inflammatory fever. And I'm using inflammatory fever because of the obvious indication that the cat has quite a bit of inflammation. So this listing here of homeopathic remedies, and all the homeopathic remedies are listed in Latin. That's just been the tradition for 200 years. So all of the medicines are in Latin terminology, but they're also abbreviated. So the homeopathic practitioner knows what all these abbreviations mean. And we don't need to go into that. I'm just kind of giving an overview here. So we have 55 medicines here for the treatment of fever that's inflammatory, and any one of these could be applicable to what our cat is presenting to us. You see, all of these medicines, these homeopathic remedies here, have been used to treat inflammatory fever in different individuals. Our question as homeopathic practitioners is which one is applicable to this particular cat. We're only going to use one medicine, the one that fits him. One other thing to say here before we move on is that the listing here, you notice that some of the words, like the first grouping here, shows that the words are in capital letters and underlined. And then the next grouping, they're in red, but they're not underlined with the first letter capitalized. And then the next grouping is they're just underlined with lowercase and so on. In homeopathy, that's called grading of medicines. And generally what it means is that the ones that are at the beginning here that are in capital letters and underlined are the most likely remedies to use. They're the ones that are most often have been found clinically to be useful in patients. That doesn't mean we couldn't use one of the others. One of the others could fit better, but it just gives us some indication. So we're going to have to define a little more clearly which of these 55 medicines might be appropriate for this cat. And the way we're going to do that is we're going to bring in another symptom that is typical, or I shouldn't say typical, I should say another symptom that this cat is showing as part of his fever condition. So if you remember, he hadn't moved for 24 hours. He wants to lie down continuously. So I'm going to use another symptom in our reference text here. It's called a repertory in our reference text that has this particular symptom, the one that you see here that's kind of colored a little bit, kind of bluish greenish, which is the patient has fever and also has inclination to lie down, doesn't want to get up and move about. And there's 11 homeopathic remedies that have that symptom. Now, what I do is put those two together in the computer program. You see down below, I'm showing the medicines that have both symptoms. So what the program does for us, the computer program, is by putting in both of these symptoms into the place that we use for analysis, what it does is it narrows it down and limits it to just those medicines that have both symptoms. In other words, we have a patient that has fever, inflammatory fever, and also that patient wants to lie down all the time. Which medicines out of the 55 have both of those symptoms? And you can see here in the bottom little window here, you can see that there are about 9 or maybe 10 of the remedies that have both. because you go up to the last one that's in bold is caladium, C-A-L-A-D, and after that the little box is empty, meaning that it didn't appear in that symptom. It didn't appear in that listing. So we've narrowed it down just by putting in those two. We've narrowed it down to about 10 or 11 remedies here that are possible for this cat. So what we're doing here is we're trying to define more clearly what the remedy may be that fits him in terms of what he's actually presenting to us. Another one we can use, one I did use in this case, about his crying out. When he was moved, he would cry from the pain, presumably. And so we do have a symptom in our reference text, which is the patient has fever and they will cry out. The term they use in the book is shrieking, which is kind of an older term we wouldn't see so much, but it also means to cry out or to vocalize, to yell or whatever, has that meaning. So if I put in, as you see in the top here, it says shrieking or crying with the discomfort of the fever. There's 14 homeopathic remedies listed. So if I put that one in as well, down at the bottom of this projection, you can see all three symptoms combined together. We only have 3 homeopathic remedies that have all 3 symptoms in their manifestation. And just to remind you, what we're doing here is we're looking for a remedy that's very similar in its effect. All of these remedies that are listed here in these symptom listings are ones that have been tested in healthy people to determine what kind of symptoms they cause. So when they're listed here, it means they will cause that symptom. So we've narrowed down to 3. These 3 are, the first one is aconitum, which is from the plant monkshood. If you study that in vet school, it's a poisonous plant, monkshood. The second one is bryonia, which is another plant, and then chamomilla, which is chamomile. So we've narrowed down to 3 homeopathic medicines to consider for possible application here. Well, at this point, we've used this reference here. We've used it as a tool to get down to a smaller group of homeopathic medicines to consider using in our patient. You can understand that as one becomes knowledgeable and skilled with the system, oftentimes this is enough. You can say, oh, I know now which one would be used because, I know the medicines, I've studied them. Or what we often also do is we look at a larger reference text, what we call materia medica. And in this case, studying the reference text of the 3 medicines that were listed there as possibilities, I selected the second one, which is called Bryonia alba, which is a common name is white bryony. And I selected that one because in other detail that's listed in the reference text, the materia medica, other detail that's listed there confirms some of the things that we didn't put into our analysis here about some of the appearance that he gives and about the fever and the level of fever and things, some details like that. So I picked this one, Bryonia alba, and it was using a 30C potency, which I realize may not mean anything to you, but it refers to the potency refers to how the medicine's been prepared in the pharmacy and what, in a very loose sense, what strength it has. And so if you were to buy it, it would say on the vial, it would say Bryonia 30C, or CH sometimes it'll say. So this cat was given that medicine. He received 1 pellet every 4 hours for a total of 4 treatments. And the treatment was stopped by the 4th dose because he was apparently recovering. He was getting up and acting fairly normal and wanting to eat and so on. So he didn't need any more medicine at that point. That's our end point at that point. Once we see that recovery is underway, then we stop giving the medicine. So he went on to recover over the next several days, and then later, after another week or so, when he had a follow-up appointment, clinical appointment, it was confirmed that he had remained normal and looked healthy at that point. So he was, our consideration was that the medicine had effectively resolve the problem for him. So if we go back to the question of research trials, you can see now, you begin to understand perhaps some of the difficulty in comparison, because the homeopathic model requires that we individualize the treatment for each patient. And we don't use that idea of diagnosis and having a label under which the patient is put and all receiving the same medicine, necessarily the same remedy. And if we had a group of ill persons or animals that we were treating with homeopathy, it's very possible that each one would receive a different medicine. Or probably if it was a group, probably there'd be some who would get the same medicine because they have the same pattern, and there would be others that receive different ones. You know, there might be half a dozen medicines that are used depending on how they fit. And so when reports are done like this, where say you have a clinical condition and they're treated with homeopathy, but different medicines are used, those kind of trials generally are rejected as not scientific or not reliable by the allopathic community, because that's not the way they do their studies. They, as I said before, they use the same medicine. So you can see already how there is a difference in outlook and therefore acceptance of what is significant just from that alone. So what the homeopathic community has done to try to compensate for this difference is using one of these three methods. You could have you could compare the two treatment methods in a clinical setting, sort of like we talked about with the use of homeopathy during epidemics, where some patients are treated with one method of medicine, and another group of patients treated with the other method, and then you compare the two. And within each treatment group, well, then you do your usual thing. So the allopathic method would involve a standard protocol, and the homeopathic would be individualized treatment, and you compare the two. And this certainly is this is probably the most actually practical and useful way to compare the two methods, because now each one does their best within that clinical situation, and you can get a sense of what the outcome might be. But oftentimes these are not accepted because they're not considered stringent enough. So another way that the research has been done in homeopathy is to try to mimic the allopathic trial method. And they will actually then group patients as to diagnosis. They'll do the same kind of approach, put them into a diagnosis, and give them all the same homeopathic remedy, even though we know that they don't all require the same homeopathic remedy, you see. So we can do that kind of, and those kind of trials have often been done to show that there's some effectiveness, but we don't see the same effectiveness we would expect to have if we were actually treating them in the way we usually do it. And the third category would be to do the homeopathic approach anyway, you know, do individualized treatment, and then compare that with allopathic treatment in the same clinical condition. And that's been done too. So I'm going to try to give you some, in what we have left here, try to give you some examples of that, so you can see how, having discussed the background here, you can see how these trials are variable. I mean, how they're done and why they're put together the way they are, because we're trying to compare two quite different systems of medicine. So here's one, the title of which is Homeopathy and Conventional Medicine, an Outcomes Study Comparing Effectiveness in a Primary Care Setting. And this is in the Journal of Alternative and Complementary Medicine, 2001. And so what they say here is that they wanted to compare the homeopathic treatment with what they're calling conventional medicine in a primary care setting with three commonly encountered clinical conditions. And they set it up as an international multi-center prospective observational study in a real-world medical setting, and so on. They had 30 investigators with conventional medical licenses at 6 clinical sites in 4 countries. And they enrolled 500 consecutive patients. And consecutive can be significant in the sense they weren't kind of like choosing particular ones. They're just taking them as they come in without trying to say, oh, this one would, subjectively say, oh, this one would be easier to treat, or I don't want to deal with this one because it's too complicated. They just took them as they came in, 500 consecutive patients, and they had at least one of the 3 complaints that they were considering. Upper respiratory tract complaints, including allergies, lower respiratory tract complaints, including allergies, and ear complaints. Those 3 were what they're looking at here. And their criteria for evaluating the outcome of treatment was, the way they define it is cured or major improvement after 14 days of treatment, was the response that they saw, of course. And secondary outcomes were rate of recovery, occurrence of adverse effects, and patient satisfaction, and length of consultation. All right, so that's the way they looked at evaluating the effectiveness or outcome of treatment. So the results were they had 456 patient visits were compared, 281 received homeopathy, and 175 received conventional medicine. As far as the primary outcome, that is, whether they had major improvement or were considered cured, those that received homeopathy had 82.6% positive outcome, and the conventional medicine treatment was 68%. Improvement in less than 1 day and in 1 to 3 days was noted in 67.3% of the group receiving homeopathy, and in 56.6% of those receiving conventional medicine. Adverse effects for those treated with conventional medicine was 22.3% versus 7.8% for those treated with homeopathy. 79% of patients treated with homeopathy were very satisfied, and 65.1% of patients treated with conventional medicine were very satisfied. In both treatment groups, 60% of the cases had consultations lasting between 5 and 15 minutes. So we can see that in this study, the homeopathic treatment came off quite well by the criteria they used, and they concluded it by saying that homeopathy appeared to be at least as effective as conventional medical care. So they're being quite cautious about what they're saying here, but you can see, certainly if you just looked at the percentages, that it looked like it did very well in comparison. So here, this study is where we're comparing the 2 treatment methods, where one group is treated with one medical system and the other group is treated with the other medical system. Now, here is another study. This is the title, actually the title of the paper is called "Is Evidence for Homeopathy Reproducible?" And it appeared in the Lancet in 1994. And this one involved 28 patients with allergic asthma. And these people were primarily or most sensitive to house dust mites. And they were then randomly assigned to either receive an oral homeopathic remedy or a placebo. And so here we're comparing, as we'll see here, these people were on conventional allopathic treatment already for their condition, for their allergy. And that treatment was continued. But what was added in was either a homeopathic remedy or what appeared to be a remedy, just a blank pill. Okay? So we're just really comparing that factor. It was a randomized, double-blind assessment of two parallel groups, one for treatment, the other placebo. They were in the study for 8 weeks. And the medicine that was used as a homeopathic medicine was the allergen material, that is probably the dust mite material, prepared in a homeopathic pharmacy to a 30C potency. And the allergen was chosen on the basis of the largest skin test wheel concordant with the allergy history of the patient. Actually, as I read this, I'm thinking, well, maybe they didn't always use exactly the same thing. Maybe they went by the skin test to decide what they were allergic to. We'd have to look at the whole paper. This is just really the abstract. However, I will mention to you, or I will comment here, that you see what they did was that they determined that the person was sensitive, let's say, to dust mites. And then they made the dust mites into the way you would make a homeopathic remedy. That's not really the way homeopathy is done. What we do is we use a different medicine. We don't use the same thing as we think caused it. For example, if you say somebody got very badly stung by bees, you would not use bee venom as a homeopathic remedy, but rather you'd use a different substance that produces similar reaction or similar eruption of wheals on the skin. So this is not really the way homeopathy is practiced, to use substance made from what they think is the cause. But this study was put together as a way to try to demonstrate the effectiveness of the method, you see. So it's going back to what I said earlier. They're trying to compensate by showing the conventional allopathic profession the effectiveness of homeopathy by trying to modify their approach to be similar. So they kept these people kept daily diaries to assess their condition, and the respiratory function, because it was an asthma, remember, an asthmatic condition, and so the respiratory function was assessed as expiratory volume measured with a spirometer, or reactivity to histamine, where they had them inhale increasing doses of histamine and measured it with a dosimeter. The results they had was improvement in the treated patients, those that received the homeopathy, the homeopathic approach. There was improvement within a week of starting the treatment, and this improvement persisted for up to 8 weeks. Remember, they did the study for 8 weeks. And it gives a probability here, which is quite good. 0.05 is usually considered the cutoff point. You want it to be below that. So 0.0003 is very impressive. Again, this is not really a homeopathic treatment. It's not really expected to result in cure, but rather temporary improvement, because they're not using it in the way that we would use it ordinarily in curing a patient. But you can see that there was a result. And the medicine is diluted and prepared in such a way that it would be beyond any physical substance. So again, it shows something's happening here. Here's another study that was done in a swine production facility. And it's called Evaluation of Preventive Homeopathic Treatment Against Coli Bacillosis in Swine Production. It was in the International Journal of High Dilution Research, 2009. And what they did was they took newborn piglets and divided them into 4 groups of about 11 or 12. One group was a control group, and the control group was treated with antibiotics against diarrhea. The second group was treated with a homeopathic remedy. In this case, they used one made from phosphorus, the element phosphorus 30C. And again, you see, now what they're doing here is they're just using one remedy for all the pigs, and that's not the way one would do homeopathic treatment. We'd individualize treatment for each little piglet, or each group of piglets if they all have the same symptoms. So what they're doing is they're just picking one that's one of those medicines that's going to be high grading in the listing for diarrhea. And the third category is what they call biotherapeutic treatment, where they took E. coli and made it into similar to a homeopathic remedy, just like the house mite thing was done in the prior study. Again, this is not really how homeopathy is done to make, there are homeopathic remedies made from bacterial cultures, but again, they think it's caused by E. coli, and so they're trying to use preparations made from what they think caused it. And that's not the way, again, homeopathy is done. And the fourth group is where they did the two together, the homeopathic remedy and the E. coli preparation. The result they had was all three groups treated with homeopathy or the combination of homeopathy with the E. coli preparation had a significant reduction of diarrhea compared to the control group. Remember, the control group was with antibiotics. Probability 0.02, which again is considered significant. The group treated with phosphorus 30C plus E. coli 30C had the highest weight gain and had a better probability, 0.001. The conclusion they came to was homeopathic and what they call biotherapeutics treatment were more effective than antibiotics in the control of diarrhea in newborn piglets. And the combination of the two preparations resulted in the best weight gain. All right. And then we have, here's a study in rheumatoid arthritis, evaluation by double-blind clinical therapeutic trial. This is in the British Journal of Clinical Pharmacology. They had 23 patients with rheumatoid arthritis compared with an equal number in a control group. All of the patients were on what they call orthodox first-line anti-inflammatory treatment, and they did not change that treatment. You can see it's really not the best way to do a study to continue that treatment, at least in my opinion, because, you know, it just throws in more complications, more variables. What would really be optimal would be have a group that's not treated, a control group, a group that's treated with, say, conventional anti-inflammatories, and a third group that's treated with homeopathy. That would be, I think, more informative. But anyway, this is what they did. They continued all the patients on this anti-inflammatory treatment. The doctor that did the evaluations of the treatments did not know if the patient was on placebo or not. In this instance, they did a variety of remedies. In other words, this is like the study I said where they will use the homeopathic method, individualize the treatment, but they're kind of trying to do it underneath a diagnostic classification, rheumatoid arthritis. And the period of study was 4 months. There was a significant improvement, again, 0.001, in subjective pain, articular index, stiffness, and grip strength in those receiving remedies, whereas there was no change in the patients who received placebo. It might be argued that the changes in the various parameters assessed, though statistically significant, on rank testing were small and of no clinical importance. But they say, however, similar changes in articular index and smaller changes in grip strength were obtained by this study by Diodar in 1973 when he compared the relative merits of 4 anti-inflammatory drugs. So they're saying that it's in the same range of improvement that was seen with anti-inflammatory drugs. Another important point in the discussion of homeopathic treatment is the lack of toxic effects observed. Out of 23 patients on active treatment, only 1 dropped out. They don't know why. And none of the other 22 patients reported any toxic side effects over the 3-month period. Okay, and then we have treatment of acute diarrhea with homeopathic medicine, a randomized clinical trial in Nicaragua. And this was appeared in Pediatrics, 1994. And this is a randomized double-blind clinical trial comparing homeopathic medicine with placebo in the treatment of acute childhood diarrhea conducted in Nicaragua. 81 children aged 6 months to 5 years of age were included in the study. And here again, they use an individualized homeopathic medicine. You now know what that means, individualized for each patient, for each child. And they did a daily follow-up for 5 days. They also did standard treatment with oral rehydration. Results were the treatment group had a statistically significant decrease in duration of diarrhea, defined as the number of days until there were less than 3 unformed stools daily for 2 consecutive days. There was also a significant difference in the number of stools per day between the 2 groups after 72 hours of treatment, and so they conclude that there was a significant effect from use of homeopathic treatment. This last one, this is a little different. This is not so much showing a trial of treatment as showing you that the medicines that are made by the method of producing homeopathic remedies shows a detectable effect. Oftentimes, the criticism that's given for the use of such substances is there can't be anything in it. There's nothing physical, therefore it can't have any effect. And we know, those of us that use homeopathy know that can't be correct because we see such strong and positive responses. And so here's a study, for example, where they're just looking at the question, if you take a medicine that's prepared in a homeopathic form, and it's diluted and it's also energized, it's not just dilution, but it's also agitated quite vigorously to activate it as each step of dilution that's necessary to do. And so the question is it possible to detect any difference between that and, say, just water or alcohol or whatever in comparison? So this was a study that was done. I can't say I really fully understand. Maybe I shouldn't say fully that I really understand this, because it seems it's not something I'm familiar with. But it was a study apparently done with some kind of looking at the spectrum of energies with this equipment that they use for infrared spectrum analysis. So they looked at these homeopathic remedies: Nux vomica 30C, Lycopodium 30C, Santonin, Sina, 3 different potencies of Sina here. And also they looked at 90% ethanol, and they also looked at alcohol made into homeopathic remedy. So they looked at all of these. They looked at the range they give us of whatever this means, 2,000 to 1,000 CMI. So they basically, as I said, because I don't know what this equipment is or how it's done, so I can't say too much about it. But they did find they were able to detect differences between the different homeopathic remedies. They said the potencies of homeopathic medicines differed from each other by their measurement, and also they differed from the material that didn't have homeopathic preparations, such as ethanol and so on. All right, so it's just kind of interesting. I put a little sentence down here in footnote. I looked up what it means. It says, I found online, it says FTIR spectroscopy provides simultaneous and almost instantaneous recording of the whole spectrum in the infrared region while minimizing background noise. Yes, it doesn't make a lot of sense to me either, but there you are. So here's an interesting little quote from Albert Einstein, just to finish up our confusion here. Physical concepts are free creations of the human mind and are not, however it may seem, uniquely determined by the external world. So, interesting. Survey maybe gives you some idea of the kind of studies that have been done. As I say, there's lots of them, hundreds really, but they fall into these categories pretty much. And usually, when these kind of things are presented, there's various criticisms, as I said, like, well, you didn't always use the same medicine in all patients, or there wasn't an adequate number, and things like that. So, but you can see that there are studies that certain people have tried to do very controlled studies. So, any questions there, Natalie?
I have 2 questions. So the first one is, are there any adverse side effects of choosing the wrong remedy? can anything bad happen to the patient?
Yes, certainly. It's there's different possibilities. One is that the medicine, you pick a medicine that's not fitting, doesn't fit real well. It fits somewhat. Does that make sense to you? It fits part, like I use, instead of on the cat Moses, instead of using Bryonia, I used one of the other remedies. It would probably have some effect, but without really improving the cat. It might aggravate one of the symptoms. So usually then what happens in homeopathy is we only use 1 or 2 doses. And if we pick the wrong one, we're able to see that pretty readily, and we know to switch medicines. Where mistakes are made is if people don't know homeopathy well enough and they keep repeating the medicine. And then it can cause some real unpleasant reactions because it makes the symptoms worse. So yes, certainly, they're medicines, they can have effects. And it really depends on how you use them. If they're used properly, as understood in homeopathic work, then we know that the medicine should be used just enough to stimulate a reaction of healing, and then we stop using it. Otherwise, it can be overused. Does that make sense?
Yes. It seemed like in one of the examples that you had, there was 55 different options that could be used for a bunch of the different symptoms. But so it seems like it's very specific. So how accurate are you guys usually on your first try finding the right medicine or the right remedy for that patient?
Well, it's like any system of medicine. When you get out of school and you start practicing, you're not going to be as accurate as you will be after gaining experience and doing more study. That's the same thing in homeopathy. When you start out, you may not prescribe very accurately at first, but you're learning, and as you go along, like I've been doing it 35 years, so I'd say a lot of the times when I prescribe, not all the time, but many of the times I prescribe, it seems to be right, and it works. But there's times when I don't have it right, and I have to adjust my prescription. We go very much by how the patient has responded to it as our criteria for evaluation. If the patient is not getting well, doesn't seem to be feeling better, isn't making improvement, the symptoms are continuing or they're getting worse, well, we know that we don't have the right medicine, so we switch to something else.
Okay.
So it's like anything. You get skillful at it after a while.
All right. And last question from a skeptic. How can basically water treat anything if the substance is so dilute it's basically not in there?
It's not just water. It's homeopathic medicine that, like you say, you start with a plant material like Bryonia, one I mentioned, is start with a extract of the plant. And then it's usually extracted with alcohol and water. So there's some part of the plant that's in the solution. Then you make a dilution of it, and it's agitated. You have to do that. And Dr. Hahnemann said originally it was the separation of the molecules was releasing an energy between the molecules that was given off into the liquid, and that's what was doing the treatment. It's not the physical substance, but the energy that holds the material together. And that it's easy to reject that, but on the other hand, we see that all the time in other areas of science. For example, we know that most chemical reactions, like have to do with digestion or say building a fire or whatever, involves a separation of molecules. That's where if you're burning wood in a fire, the reason it gives off heat and light is because you're separating the molecules in the wood. So there is energy there. It's just simply that in much of biology, that's not a concept that's accepted, that there is an energy that's in substances. It's released, a non-physical energy. It's very similar to in physics. They talk about the particles actually have an associated wave with them, like electrons and photons, and that the field they refer to as the field, the wave field, is actually considered more real than the particle is. And it's a non-physical form of energy. So in the same way, in homeopathy, we consider that there's an energy released. Now, you can say, people can easily reject that, but of course, they only reject it because they don't know. There has to be some explanation for it. I will just mention briefly, for example, you may not be familiar with it, but this last few years, there's been some work by Dr. Luc Montagnier. I don't know if you know his name. Does that ring a bell for you?
No.
He's French scientist. He's the one that received the Nobel Prize for identifying the AIDS virus.
Okay.
And he has done some research that he's published where he has shown that organisms like AIDS virus and E. coli and other organisms like that, he's been able to measure that they give off an electromagnetic signal into the fluid they're in. And he's been able to take that fluid that these organisms are in, like the AIDS virus or E. coli, for example, or I'm trying to think the other one. He had a range, several of them that he used. And he was able to take that liquid and filter it so that the physical organism was completely removed. And that was confirmed by trying to culture it, the liquid. You follow me? He was trying to culture it in the laboratory,
yeah.
and he could not grow it. And then he would use enzyme DNase to dissolve any DNA that might be there and make sure there was nothing carried over. And then he was able to measure an electromagnetic signal in the fluid that was characteristic of that organism, that was distinct for each organism, a particular signal. And so what he was able to do then was take that liquid and add it to human cell cultures, and the organism would be recreated by the human cells, like the AIDS virus or the E. coli. So there's a lot of stuff here we don't know. I mean, as you know, we're getting into an area here. Basically what we're coming up against is there's just some aspects here that we don't fully understand yet. And it would seem to me that the most scientific way to approach this would be to have an open mind about it and see what we can learn. You know, it's rather than just say, oh, I already know it can't be right, because that's, you know, that closes off any inquiry.
That's really interesting, actually.
Mm-hmm. It is. It's fascinating.
Mm-hmm.